staff management. This is a topic that you're going to use as a new graduate nurse, and there are going to be situations when you see something going on and you're not exactly sure what to do about it. So I'm going to give you a little decision tree, essentially, that you can use, a sequence of questions you can ask yourself, and so you know what you should do in response to whatever situation you're observing. Now, on the NCLEX, this is basically asking you, how do you intervene with inappropriate behavior of staff? Okay, how do you intervene with inappropriate behavior of staff? There's typically 4 answers that you're going to see on each one of these questions. Okay, and they're substantially similar pretty much all the time. There's always exceptions, yes, but there's four answers that typically come up. Number 1 is you tell the supervisor, or the second thing is you would either intervene and take over. Okay, so number 1, tell the supervisor. Number 2, intervene and take over. Number 3, you can counsel them later. And the last option is to ignore it. All right. So A, B, C, D. A, tell the supervisor. B, intervene and take over. C, counsel them later. Or D, just ignore it. All right. Don't ever pick just ignore it. Okay. That's never the right answer, because there's always some way that you can help your staff grow and develop. Okay. It's one of your roles as an RN. So how do you choose which answer is correct? So when you see staff behavior, the first thing I want you to ask yourself is what this person doing illegal? Okay. If what they're doing is illegal, then you tell the supervisor. Okay. If what they're doing is not illegal but still inappropriate, then you ask yourself the question, is the patient or staff member in immediate risk of physical or psychological injury? And if the answer to that is yes, then what you should do is intervene and take over. Intervene and go help out. Okay? Then if the answer is no to that one also, then you'll go to the third step and ask yourself, is this behavior legal? Not harmful, but just simply inappropriate. Okay, so what they're doing, it's not breaking the law, it's not hurting anybody, but it's maybe just rude, right? Or just inappropriate, or not politically correct, say. And if the answer to that is yes, then what we're going to do is counsel them later. So if the NCLEX question asks you, what should you do in this situation? You walk into the break room and you notice that a coworker is diverting drugs, right? Diverting drugs is taking them from the hospital and not giving them to a patient, but using them yourself. That's diversion, right? So go to step number 1. Ask yourself, is what this person doing illegal? Yes, right? So what are you going to do? Tell the supervisor. Okay. The next question would be, you overhear a nurse mentioning that they don't have time to get their client pain medication prior to doing a painful dressing change, and the client's just going to have to suck it up because they're busy today. Okay. Is what they're doing illegal? Maybe, but probably not, right? So, but is a patient or staff member in immediate risk of physical or psychological injury? I would argue that yes, okay, that client is at risk for either physical or psychological injury. So what are we going to do? We're going to intervene and take over. Okay, we're going to say, I've got a moment, let me help you out. Okay, that's what we're going to do. We're going to intervene and take over. And then number 3, last question is, you overhear a nurse talking to another nurse about how the new graduate nurse who's on the unit is stupid and doesn't know anything, and should have never been hired in the first place. So again, go through the decision tree here. Did what that nurse do break any laws? Was it illegal? No. Okay, so we're not going to tell the supervisor. What the next thing we're going to do is going to go to, is somebody at risk for harm? No, nobody was at risk for harm. But was this behavior inappropriate, right? The last question. Was it legal, not harmful, but simply inappropriate? Yes. Okay, entirely inappropriate. So what are we going to do? We're going to counsel them later. Okay, that's what we're going to use as a decision tree, and we're not going to ever select just ignore it. Okay, there's always room for growth and development when it comes to staff management. So hopefully that gives you a couple of tools that you can use as you're going through these questions in nursing school and on the NCLEX, and then also when you're dealing with people at a personal level, when you're out on the floor in your new job, because you're immediately going to be supervising people. Okay, you can say, I'm a new graduate nurse, I'm not supervising anybody. Yes, you are. There's assistive personnel, there are other people that are helping in the care of your clients and of your patients, and you are partially responsible for what's going on and for making sure that your client and your patients are receiving the best care that they can. You are their best advocate, and that's your job. So those are some tips for staff management.